Tell you about one other Texas company called WellMed. While the Reid bill would finally give Medicare the ability to experiment with medical homes and care coordination, a San Antonio-based company, Medicare Advantage company called WellMed, has been using a medical home model to coordinate patient care and emphasize prevention for nearly 20 years. To quote from an article last month in Inside San Antonio, the healthcare delivery model at WellMed puts the patient at the center of the team directed by a primary care physician. That team may include a nurse, a health coach, a hospitalist, a social service worker, and a physician assistant. According to WellMed's CEO, we really do have to bring back the old-time primary care doctor who cared for you, who was concerned about you, who was part of your family, and you were part of their family. It's the primary care physician who knows all about you. So if you need a specialist, they know the best specialist to send to you. If you need to go to the hospital, they make sure you get the appropriate care at the right hospital. They are a coordinator of your care, and that's really the concept of the medical home. There's no question in my mind that this model has been saving lives in my state. Here's a story about one Texan whose life was saved by physicians caring for him at WellMed. For years, Crohn's disease weakened, we'll call him Ed's immune system and left him susceptible to infections. One morning in 2001, he lacked energy to even get out of bed. His breathing became labored, and he developed a cough that sounded wet. His worried wife called his primary care physician at WellMed, Dr. Marlene Sanchez, who wanted Ed hospitalized immediately so she could order a nuclear scan of his lungs. But he protested. She told me that if he refused to go, I should call 911 and have the paramedics come get him. His wife, Annette, said she heard Dr. Sanchez talking to me, the urgency in her voice, and that convinced him to go. The scan confirmed Dr. Sanchez's suspicion. A potentially fatal blood clot had traveled from Ed's leg to his lungs. Fortunately, he was successfully treated and recovered, and Ed and his wife recently celebrated his 74th birthday. Now, Annette credits Dr. Sanchez for saving her husband Ed's life and for acting as a catalyst that keeps him thriving even in his golden years. She said, "We've seen an abundance of doctors, from the cancer doctors to the dermatologist, gastroenterologist, the blood doctor, the heart specialist. Ed's gone through it all. And they've all been coordinated by his primary care doctor. I've been to other doctors outside of WellMed, and you don't get the feeling that they are communicating like this." Well, many